The PAGS test that we are demonstrating in this video is a simple and highly accurate ruminant chute-side pregnancy test that works by detecting the pregnancy-associated glycoproteins. This test can be performed as early as 28 days after insemination. Each test kit includes the main materials that you'll need: the test itself, a pipette, the conjugate solution, a needle, and an anticoagulant blood tube. Just keep in mind that cleaning materials and gloves are not included, so you will need to have those ready before you begin.
When practicing low-stress cattle handling, you want to consider 5 rules. Number 1, approach cattle slowly and calmly. Find and enter the flight zone by moving calmly and slowly as you approach cattle. Once you've reached the flight zone, you can start to apply pressure to get the animal moving. 2, release pressure after it's applied. When cattle are moving where we want them to, release the pressure. If the animal stops or try to move in a different direction, reapply that pressure as needed. 3, observing movement and controlling direction when necessary. The longer you handle cattle, the better you will become at reading what they might do. Make sure to use your pressure and release technique to keep cattle moving where they need to go while allowing them to exercise their herd mentality and follow the leader. 4, know how to use your tools, where to stand, and how to work quietly. Flags, paddles, and hot shots all serve different purposes. Based on the facility, you will need to utilize your tools and body positioning differently to keep cattle moving slowly and calmly. In this scenario, handling tools weren't necessary. Now 5, work with the cattle and facilities, not against them. As handlers, we cannot physically make cattle go anywhere or do anything. So understanding the facility you are using or how it is designed can put you at an advantage.
All right, guys, so I'll be going over the basic procedures here over this blood draw and kind of how to do it for this test. So the first thing you'll need to do, and we did here, was get yourself some paper towels, possibly some soapy water. But thankfully our girl here was pretty clean, and you just want to clean the back side of that tail towards the base, just scrub it real good. Like I said, she was pretty clean, so didn't have to do too much here. We will be using a 20 gauge needle and vacutainer system that came with the pregnancy kit. You can use any style of needle, like a lure lock or the other kinds as you feel comfortable, but this works for us and it came with the kit. And so you want to palpate first along that tail, kind of along the vertebrate there, and you want to find the space in between the vertebrate. That coccygeal vein will run right parallel to it in that space, and that's where you want to stick her. We want to go in just about 90 degrees, not really in an angle like you would think. And we did that here. We attached that vacutainer style needle to the anticoagulant tube. Thankfully, all I had to do was just slightly readjust what you saw right there, and we were able to get enough blood out of there. All you need is 1 mil for this pregnancy test and most other chute side tests. And then we just want to kind of rub along the sticking site just to hopefully prevent any hematomas or excess blood loss there. We recap our needles since we have to walk a few extra feet to the chute side table. And we're good to go. Just mix it up, the blood up here, mixing it with that anticoagulant serum inside that purple top tube. And then Dakota here will be good to draw it and dispense it into our chute side test.
Although the kit provides a pipette for applying the sample, we used a more direct approach. We placed 2 drops of blood and 2 drops of conjugate straight onto the test using the syringe and the dropper bottle. After you've applied the sample, let the test sit for about 5 to 10 minutes, and once that time is up, your results will be ready. We used an open cow for this demonstration, so our test is negative. When you're done, make sure you follow the proper disposal procedures for your operation. Needles should go into a sharps container, and any blood or biological materials should be disposed of safely and appropriately.
After administering our test, we can send our subject home. Now, a thing to note when releasing cattle out of a chute, we first release the head and then the body. When you release the body first, cattle often pull back to try and release their head and end up pushing to the back of the chute. This kills the good cattle flow that we are trying to achieve.